Hi, everyone. Thanks for joining. We're gonna let people hop in for a couple minutes and then we'll get started. All right. Thanks for joining the first event in Applied Basic Science webinar series. So this series will be building on one another, providing a variety of topics that will come in handy to answer questions that may arise when adding CBD to your pet's regimen. So tonight, our focus is understanding the different types of CBD and what's right for your pet's needs. We brought in one of the authorities to teach us more, Dr. Stephanie McGrath. Dr. McGrath is an assistant professor at Colorado State University, College of Veterinary Medicine and Biomedical Sciences. Many of you know her as the principal investigator and lead researcher on multiple clinical trials using CBD oil. First, the safety trial, and then the trials for epilepsy and other neurological diseases. We are so excited to hear Dr. McGrath's presentation. Welcome, Dr. McGrath.
Hi, thank you so much. Sorry, I should be really good at this technology and I'm still learning. Let me pull up my presentation and we'll go ahead and get started. Thank you so much for the introduction. Let's see. All right, please stop me if this does not look like it should. Otherwise, without further ado, I will get started on today's topic. And so, like it was mentioned, we are hopefully going to be embarking on a series of talks, this being the first one, and with the goal of introducing you to some of the terminology, some of the science that's backing the use of CBD, and some of the uses, some of my research, et cetera. And so there's a whole slew of information out there that's still available that I am really going to be focusing on a very kind of small portion of some of the questions. And my goal for today is to introduce you to some of the technology, some of the, terminology, some of the different ways that we discuss CBD and hemp and marijuana and all kinds of different words that are kind of floating around there in discussions on the internet with your veterinarian and pet stores, et cetera. And so I'm hoping that this will help shed some light and help you guys make informed decisions, help you with your consumer responsibilities when it comes to shopping and using CBD for your pets. So that's kind of the goal of this evening, with future presentations addressing different things that may still be of interest or confusing. So please let these lovely folks at ABSC know what is of particular interest, and we can definitely try to address all of your needs. So tonight's presentation is going to be focusing on the different types of CBD. So what is CBD? Where does it come from? What are the different forms available, and sort of the benefits of each one? What are the pros and cons or advantages and disadvantages of all the different types out there? And so with that said, and believe me, I'm learning as I go. I can't even exactly remember, but maybe 5 years ago or something like that, ABSC and I embarked on our research projects. And so literally I was learning all of this terminology not very long ago as we got started. I didn't know anything. I obviously had heard of CBD and marijuana and hemp, but honestly, it was all very foreign to me when we started talking about what this plant was and what we could do with it in veterinary medicine. And so, again, my goal tonight is to introduce you to some of the is to kind of start with some of the basics, so we have that first building block and foundation in place as we talk about other aspects of CBD and veterinary medicine. So cannabinoids is where I was going to start. Sometimes they're called phytocannabinoids, just meaning that these cannabinoids are produced by a plant, namely the cannabis plant. And there's lots of different cannabinoids, actually over 100 have already been identified, as well as other constituents of the plant as well. Cannabinoids, the most common two that are discussed, that are researched, that are scientifically evaluated are cannabidiol, which is known as CBD, as well as THC. But there are many other cannabinoids that are naturally produced by the cannabis plant, including some of which you may heard of, things like CBG, CBC, CBN. And so there are other very, very commonly discussed cannabinoids as well. And then there are other constituents in the cannabis plant, things like terpenes, flavonoids, other amino acids, minerals, vitamins, essential oils. And so really a very rich and full plant product. And so as we start talking about these different constituents, hopefully this will kind of help build the basis for the different types of products that are available. So when it comes to, we'll kind of backtrack and talk a little bit more about CBD itself, but just to touch on those two bottom bullet points, so the terpenes and the flavonoids, just so you have a basic understanding of what they are. To be honest, there's a lot that we still don't know about them, but so far we've identified over 200 terpenes from various chemovars of the cannabis genus. And each strain of cannabis seems to produce a very unique terpene profile, which may consequently have equally unique therapeutic effects. Terpene molecules each of them contribute their own physiologic and therapeutic effects, as well as, we believe, interact synergistically with the other compounds of the plant to enhance that clinical effect. Flavonoids are also a very diverse group of naturally occurring compounds that are mainly responsible for the plant's coloration, and they biologically help attract pollinators. So they have a very important function out in the wild, if you will, in the world of natural growth. But of the flavonoids that are produced by the cannabis plant, there are over 29 of them that are considered pharmacologically active. And again, all of this is probably the tip of the iceberg in our understanding of the cannabis plant. The flavonoids, in very similar fashion of the terpenes, are also thought to work synergistically with the other compounds of the plant to produce medicinal benefits. And so what exactly each terpene and each flavonoid does, I think, is yet to be determined. But I do think that there is agreement, or at least a school of thought, that they contribute to the medicinal value, at least for certain ailments in certain individuals. And so that's kind of the basic structure of the cannabis plant and the different compounds that are extracted from it. So going back to the phytocannabinoids, or CBD and THC, again, these are molecules that are synthesized by the plant, CBD being the non-psychoactive cannabinoid, the most common one that we discuss, and then THC being the psychoactive cannabinoid, the compound that's responsible for producing the high that we talk about. All of these phytocannabinoids act on our endocannabinoid system, and I will give you a very basic overview. I know that probably none of you want to go delve way into the science side of things, so I won't get involved in too much detail, but it is actually a very interesting, complex, and very highly regulated system that has been really just recently, Dr. Meshulam in Israel was really the leader in discovering the different components of the endocannabinoid system. But the basis for it is why, if we are able to ingest or inhale or somehow get these cannabinoids into our system, why do we experience either recreational highs or medicinal benefits? Why would that occur unless our body was well suited to accept these compounds? And so that's really where the endocannabinoid system comes into play. So the endocannabinoid system is a system that is present in our bodies as well as animals. And so we know that this is a component of every single one of our bodies, as well as companion animals. I mean, even to worms and insects, almost every animal that we've looked at has at least some form of the endocannabinoid system, the dog's endocannabinoid system being remarkably similar, we think, to humans. And so it's composed really of three main things: the endocannabinoids. So basically, endocannabinoids are just like naturally occurring THC, CBD, all of the different cannabinoids that are produced by this plant. We have our own form of those called endocannabinoids. They are released in certain situations. So, and for a whole host of situations, anything from infection, your immune system, different, the runner's high, for example, is responsible for releasing one of the most well-known endocannabinoids called anandamide. And so we produce these natural neurotransmitters that bind to receptors that, again, are naturally produced and occur in our bodies. Again, the two most common receptors are CB1 and CB2, CB1 occurring mostly in the nervous system, and CB2 very big component for the immune system. But we do believe there are likely other receptors as well. And then there's enzymes, and I won't go into those, but that's basically again, naturally produced molecules that are responsible for transportation and breakdown of the endocannabinoids. So what is the role of THC and CBD and other cannabinoids? Well, THC actually binds CB1 and CB2. CBD, however, does not have a high affinity for these receptors. We do believe that it has an effect on the receptors via other mechanisms, however. So CBD really is a very big player in a lot of the conditions that we are currently researching and have anecdotally been been treated with CBD. And so really concentrating on the more science and research side of things, a number of the diseases listed here are in the process or have been researched. The strongest scientific evidence is with CBD's effectiveness is for epilepsy. So that's the only FDA approval of CBD as far as diseases go. So that's actually in humans, a very heavily researched side of CBD, but there are, again, a whole host of other diseases that are potentially helped by CBD and are in the process of being researched in both the human and the animal side. CBD is non-psychoactive, like I mentioned, and it also does not seem to exhibit any dependence potential or indicative of any abuse potential. And so it does seem to be a relatively safe compound, and it also does seem to have medicinal value. So two really important aspects of CBD. Last terminology that I'll bore you guys with when it comes to this plant is hemp versus marijuana. So now, so far, we've talked about CBD and THC being the cannabinoids that are produced by the plant. We know the plant also produces other constituents that may or may not have medicinal value. And then we also know that there are different types of plants. So hemp versus marijuana. Hemp plants are, in the US, we've sort of arbitrarily placed this limit of 0.3% THC on these plants as they're growing. That is a number that is placed on these plants by the government, and it does vary. So in different regions of the world, hemp is defined slightly differently. But the most important aspect of it is that it is very low in THC. So that's really the take-home message: is hemp is low in THC, produces CBD along with other cannabinoids, generally very rich in CBD. So therefore, the plant as a whole is considered non-psychoactive. Marijuana, on the other hand, does not have to abide by that THC threshold. And so generally speaking, marijuana plants, although these are all cannabis sativa most of the time, all cannabis plants, hemp is low in THC, very rich in other cannabinoids. Marijuana does not have to abide by that. So generally it's much higher in THC and as well as other cannabinoids. So it produces CBD, but it doesn't but we have that high THC content as well. And so usually produces a psychoactive product. Okay, so for today's focus, we're talking about hemp plants. We're talking about extracting cannabinoids from those plants. So hopefully that terminology has kind of built a foundation. I'm hoping I didn't get too technical or too confusing, but hopefully that kind of helped build the foundation of some of the terms that we throw around. For my research, as well as the products that ABSC produces, are cultivated or made from hemp plants, and they are generally producing products that are very high or rich in CBD. And the products that we use in our research is also very similar in that it is very rich in CBD, but it does contain trace amounts of other cannabinoids as well. And so going into a little bit more detail, how do we get from this plant to a product that we can use, whether, again, it's an ingestible oil, a capsule, a cream, an inhalant, whatever form you want to talk about? How do we get from one to the other? And so I was hoping to spend just a few minutes talking about the different ways that we extract CBD and cannabinoids from this plant that is growing. So CBD and other cannabinoids are extracted from flowers and leaves. So generally they leave behind the stalk, they leave behind the seeds, and mostly because those really aren't the rich parts of the plant when it comes to the components that we're looking for medicinally or recreationally for that matter. And so they harvest the plant, they remove flowers and leaves, and then they dry the flowers and leaves in very controlled environments. So it's really important that they're dried at a certain sort of a very regulated way so that we don't produce molds and other things if it's too slow. And so we're able to do it in such a way that we preserve the naturally occurring components of the plant. And then once those flowers and leaves are dried, they are put through an extraction technique, and that allows us to take away the cannabinoids, terpenes, flavonoids, et cetera, from the plant and produce this, what we call a crude oil. So it produces this product that is essentially rich in all of the things I just talked about. And then from there, we can make other changes that allow us to either remove certain cannabinoids or others. And so it's kind of a process from there. And so the first step in the process, or the different, sorry, let me back up. The different techniques that we use for extraction are essentially three. One is carbon dioxide extraction, the other is steam distillation, and then the third is solvent extraction. And I'll go through each of those in a little bit more detail. Again, the intent isn't to get too sciencey or bore you. The intent is to give you, again, just some education around this whole industry, because from my standpoint, it's so unregulated and there's so much confusing information out there that for me, it really helps as a researcher and a scientist to understand what is happening to this plant. What am I using? What am I giving these patients? And I would imagine as a pet owner, you'd feel the same way, and understanding and making educated decisions about what you want to be giving to your dog, because the FDA is not going to tell you that. It's really kind of a free-for-all out there. And so my hope is that this helps you understand what's happening. And so carbon dioxide and all of these techniques have pros and cons. But to start, carbon dioxide extraction uses supercritical carbon dioxide to separate CBD from plant material. Supercritical is just a reference to the carbon dioxide that's that's used, which is a combination of both a liquid and a gas state. So it's kind of this balance and has properties of both liquid and gas. So they call it supercritical. Sometimes that extraction method is called supercritical fluid extraction instead of carbon dioxide extraction. Just so you know, those are synonyms. But basically, there's this whole series of chambers and pumps that are pressurized that expose the plant, so the plant material, to carbon dioxide at a very high pressure, a very low temperature, and it results in this plant extract. So the CO2, the carbon dioxide, is able to break down the hemp, allowing the oil to separate from the plant material. And so you end up with this product that is very full in all of the oil, but not the actual plant residue. And so that's discarded or used for compost and other purposes. It is overall a very safe and efficient way of extracting CBD. And also, unfortunately, very expensive, and we'll kind of go through that in a moment. Steam distillation is another way of extracting CBD. So for this, essentially, you heat up oil, the steam travels upwards into this flask that contains the plant material. It then uses the steam to separate the oil vapors that contain CBD. These vapors are then captured in this tube that condenses them into an oil and water. Once the oil and water mixture is collected, it's distilled to extract the CBD from the water. And so it's essentially just uses steam. It is a technique that is very, very commonly used, and it's been used for centuries. It's probably one of the oldest techniques of separating out the oil. But it does require, it's very inefficient. So it requires a lot of hemp plant to extract a modest amount of CBD. So it's not a very efficient method. And it's also hard to anticipate the exact amount of CBD that will be in the final product. And so it's not sometimes used for those reasons. The third method and the last is solvent extraction. So there's different solvents you can use for this. People have used in the past hydrocarbons, more commonly. Currently, people are using natural solvents such as such as ethanol or olive oil. And so solvent extraction is much more efficient than steam distillation, but it also and is also much less expensive. So it's a very commonly used extraction technique. Um, People don't generally use hydrocarbons, or at least you should be. Maybe people do, but it's definitely something to be aware of, because they can leave behind toxic residues. So more often than not, companies are reaching for ethanol is a very common natural solvent that's used. Um, and those are just as effective at extracting the CBD oil, but they do remove the risk of that toxic residue. So the CBD then is, the extract then is at the end is a lower concentration of CBD than it might be with the CO₂ extraction, but it does become more efficient than the steam distillation. So there's kind of pros and cons to all of these. I did include a table so you can kind of have an overview, because I know that was a lot of words, but essentially carbon dioxide, steam, or solvent extraction. And again, they all have pros and cons, CO₂ being the most efficient, the highest CBD concentrations, but the most expensive. Steam distillation, very inexpensive, no concern about toxic residue, but very inefficient. And then solvent extraction, and I'll just skip to the bottom since we don't want to use hydrocarbon solvents. So natural solvent extraction, very efficient, very inexpensive, but you do have lower CBD concentrations in the final product. So what happens now? So now you've used one of these techniques and you basically end up with this crude oil that's consisting of all of these different cannabinoids and terpenes and amino acids and everything kind of in this oil. And so from there, you can either further distill it, and there's different levels of distillation, or you can essentially use it, what they call winterize it. So you can essentially use it as is, containing all of the benefits of the plant. So the first product that we'll talk about, so the first type of CBD or hemp product, is the full spectrum distillate. The second one that we'll talk about is an isolate. So that's pure CBD essentially. And then the third one we'll talk about is a broad spectrum distillate. And so I will go through each of those in a little bit more detail. So full spectrum CBD, or some people call hemp oil extracts, you'll see those used synonymously, is the product after the extraction process that contains, like I said, everything from the plant. So all of the cannabinoids that were present in the plant, and all of the vitamins, minerals, fatty acids, terpenes, everything that we've talked about is present in this final product. So it does contain THC, but like we talked about with hemp plants, they're very low THC producers. And so the final product should contain low amounts of THC. So kind of trace amounts of cannabinoids with a very rich CBD outcome. Some potential disadvantages of full spectrum products are that they might have, and we'll skip to the third bullet point, a stronger flavor and odor. So that's where you kind of get that hemp or earthy flavor that some people really like, and I think some are not as attracted to. Animals, honestly, I would say there's some that don't seem to care at all. There's some that I wonder if it was a little less hempy, that they would like it better. And so the flavor and odor could be a pro, but I think in many cases it's a little bit strong. You do have the potential for psychoactive or sedative effects. Remember, it does contain THC. I did include drug tests, obviously, for our pets. We don't care about that. But point being is that if there's THC present, and we know THC can be of concern in animals at high levels, there's some people that might shy away from a product like this. But I would say in general, the THC is so low that those two bullet points really aren't a major concern. And then the pros really, I think, are obvious. So we have all of the compounds in the naturally occurring plant. And so there is the potential that there might be some benefit from even small amounts of these other constituents, making it a pro. People talk about the entourage effect, which I'll bring up because it is kind of a widely used term now. And basically, the entourage effect is exactly what we've just talked about. So it's the idea that these other constituents of the plant, so other cannabinoids, terpenes, amino acids, et cetera, that naturally occur in these plants may complement each other and result in better results and greater bioavailability of that CBD. So a lot of people, there's kind of this school of thought that CBD is better able to engage the endocannabinoid system and allows better results when other cannabinoids are present. And it's not, in my opinion, it's not proven science at this point. I think that there's reasonable data out there to suggest that this might be true, but I think for now, I think I would say it's more of an individual preference. So some people might feel like, you know what, it's the same amount of CBD and I feel so much better when I use a full spectrum product as opposed to pure CBD. So there may be a really individual basis and effect that this may have. But just so you guys are aware, that's what entourage effect means. It does undergo less processing. So this is kind of the most natural end product after the extraction process. So really there's not much further processing that occurs beyond the extraction. So that definitely appeals to some people. So the second discussion point or type of CBD that's out there is something called CBD Isolate. CBD Isolate is essentially pure CBD. So in many cases, it's about 99% CBD. So they really remove all of the other cannabinoids, but that in turn includes terpenes, fatty acids, et cetera. So it basically takes everything else out of this oil that you end up with after extraction, and it leaves you with just CBD. And that comes in this kind of crystalline form. So this is a very white, flavorless powder. So no taste really associated with this. It is less expensive oftentimes than other forms of CBD because it doesn't contain THC, because it doesn't contain any of the other cannabinoids. Oftentimes this is a bit less expensive, no flavor, no odor. So it does have some advantages for sure. Some people do like the idea of using a very pure substance. So something, when they're feeling overwhelmed I've had a lot of pet owners that just feel kind of overwhelmed with the whole market, that it's like, I just want to give my pet CBD and there's these terpene profiles and these other cannabinoids and I don't know what is going to work and not work. So some people, especially first time pet owners that are using CBD, like the idea of using an isolate because they know exactly what's in it. You know what may work and may not work. When you're dosing it, that you're dosing just CBD. So sometimes it's kind of a nice way to start out with using CBD. Again, on the human side, drug tests are a pro. You don't have any concern about having THC, even trace amounts in your product. Like I mentioned, tasteless and odorless. So sometimes, again, that's nice because you can kind of put this powder in any product and it will take on the taste or odor that is associated with that product. So it doesn't have that hempy kind of earthy odor and flavor. Con for this particular product, as we talked about, it does not contain the whole plant. So it does not have some of those benefits that people talk about with the entourage effect. Last product that we'll talk about is a CBD distillate. So this is a broad spectrum CBD. Those are kind of synonymous. So broad spectrum distillate, distillate. So those are kind of all interchangeably used. And what we mean by that is that it's basically everything that we talked about with the full spectrum product minus the THC. So it contains everything else in the plant, but they've essentially removed almost completely the THC. So the nice part about a broad spectrum product is that you will still have the whole plant benefits minus THC. So if THC has an effect or is considered synergistic, then you're not going to have that benefit, but you'll have all the other cannabinoid profile, terpenes, everything else we've talked about present in that product. So no concern about psychoactive effects because the THC is removed. Overall, there is less research and less availability of a broad spectrum product. It does tend to have the flavor and odor that your full spectrum product has, but oftentimes a little bit more mild. That's not true across the board, but oftentimes it's not quite as intense as the full spectrum. So, like I kind of said, I honestly would consider there are advantages and disadvantages of all of these products. I think that ultimately, whether you use an isolate, a broad spectrum, a full spectrum, that it is a very individual decision, that there are pros and cons to all of it. And so I may have just kind of confused you even more in terms of being a consumer, but I think overall, there's not a right or wrong answer. I think it's more of an education. So understanding when I buy this product, this is what I expect to be in it, and this is what I would like to try. And I think all of these are acceptable in pets, and I think they're all going to have pros and cons when it comes to different animals, to different diseases, to different dosages, et cetera. And so some considerations when you're thinking about purchasing a product is try to think about what you are doing with it. So what are you trying to treat? Why are you considering CBD? And I think those are incredibly important questions. So are you using it for fun because it's a fad, which is okay? Are you using it because your dog is elderly and has, 8 different problems and you're hoping CBD might help with something? Is your pet really anxious and you just want to get a good night's sleep? Are you, but otherwise young and healthy? Are you, kind of taking into account all of your pet's issues? That may help you make some decisions. And I'll explain that in a second. Why are you choosing CBD? Are you looking for this entourage effect? Are you looking for just kind of this overall geriatric improvement for your pet? Or are you trying to treat something that is very specifically tied to a certain cannabinoid, whether it's scientific or anecdotal? What is that goal and why CBD? What side effects are you concerned about? So is your pet already very sedate? Maybe that's not a good thing to add THC to. Is your dog crazy? Maybe that would be good a reason to add THC. So there is kind of all these consumer related questions that I think should be considered when you're thinking about purchasing a CBD product. So full spectrum, I would say, and these are kind of just my opinion. And honestly, I think it really depends on your beliefs, your personal preference, how your dog reacts. So maybe you didn't have very good luck with the isolate. Maybe you need to try a full spectrum product, or maybe you tried full spectrum and your dog was just not acting right. Maybe he was acting a little bit off or sedate or lethargic, and you really want to see what the benefit of CBD alone does. So maybe switch to an isolate. So ultimately, it's a very individual decision, but I would say full spectrum, I think, can sometimes add benefit when you're treating a more severe condition. So something like epilepsy, cancer, those types of things might, severe pain might respond better to that full profile, taking advantage of that entourage effect. We'll go to the next one. So isolate, maybe in a condition that you'd need very high doses. So maybe something like epilepsy, maybe you're trying a full spectrum product and the dog maybe responds, but you're having side effects that are less than ideal. So maybe in that case, try an isolate where you can go way up on CBD, most likely without having the effects of the other cannabinoids to worry about. Maybe the flavor is really tough on your animals. So maybe using something like an isolate might help with that. Maybe it would be a more palatable solution for your animal. And then broad spectrum, again, if you just want to take away the THC and not worry about THC toxicity, which again, I'm not sure is a very well-founded concern if you are properly assessing your product. But if you want to just remove that anxiety and remove that concern, then maybe broad spectrum would be a good choice. And so, like I said, everyone's going to have a different opinion, and there's lots of options out there. I think the most important thing, honestly, that you can do is to make sure that you know your product. Make sure that you have a good relationship with the company and that you understand what you're buying and what's in the product that you're buying, because ultimately, like I mentioned at the very beginning, it is a buyer's beware market. I mean, there is, company after company that puts these products out there that are alarmingly not what they say they are. And there's actually a couple papers, one in on the human side in JAMA that came out now a few years ago, and then a recent one that came out on the pet side, looking at the different products and really what is in them and evaluating them critically. And it was pretty eye-opening. And so I would say, as a consumer, do your due diligence as best you can. Companies that are available to talk to you, that will provide what we call a certificate of analysis, which I'll go through, that can help explain the different products and what might help work for you or your pet. Companies that support science, so companies that show an interest in research and science and trying to build the scientific foundation. I know that's not a possibility of every company, but to me, it really speaks highly of companies when they're able to show that they have a strong interest in looking critically evaluating their products. And so I think doing your due diligence as best you can until we have a better regulated system is going to be extremely important. And so I'll just go through, I have a couple slides on the certificate of analysis, or very commonly called COAs, and then I'll be done and I will take some questions. So certificate of analysis should be readily available and provided for each batch of product that you buy. So if I went online today and I ordered a hemp product, and it claims in this example that it has 100 milligrams per mil of CBD in their product, that number is usually referring to the CBD. I should be able to have a certificate of analysis, and I should have included one with a batch number on it. But basically, the bottle that I'm ordering should match the certificate of analysis batch number. And so those should line up. So getting a COA from a previous batch and you're buying a brand new one, who cares what was made last year? We need to know what you're buying today. And so that should be very easily obtained. So then you're kind of presented with this, in my opinion, very confusing sheet. And this is kind of the basic one. So it's going to look different depending on what laboratory they're using, but essentially you should get a profile. So you should have each of the cannabinoids that they're testing at the lab listed, and this is a very good profile. Most of them are. I haven't come across a lab that hasn't appropriately tested for the for the cannabinoids that we look for or commonly care about. And so for each of those, you're going to have a list of how much is present in the product. And so you can see that on the right side of the screen in mgs per mil or mgs per grams. And so if you look at the mgs per mil, 100 is what they claim is in their product. 100 is what, if you go down to CBD, is what is actually present in their product. So that is totally acceptable. The FDA and very common pharmaceutical acceptance is 10%. So when you go buy a bottle of Advil, that pill that you're taking, so say it says each capsule has, or each soft gel or whatever has 200 milligrams of Advil in it, then they accept up to 10% variance. So it could have, that capsule that you ingest could have 220, or it could have 180 variants. And so that's acceptable. So if I received this back and it said CBD 110 or 105, I would still find that totally acceptable. And so that's one thing you can look for. It does evaluate THC. The Delta 9 THC is the one that is psychoactive. This product claims to be a pure CBD isolate. So theoretically, it should not contain any other cannabinoids, and it doesn't. And so you want to make sure that THC is low, less than that 0.3%. You want to make sure that the CBD is what it says it is. And that's really what your kind of primary focus should be. Now, a lot of companies, not all, will also provide other forms. And so some companies will test for what we call residual solvents. this comes into the discussion about the extraction process. So are they using a solvent that is not removed during the extraction process? So did it not properly evaporate? And so you can see, let's see, 1, 2, 3, 4, 5. I think the fifth one down is ethanol. So if they're using an ethanol solvent extraction, then that should be essentially 0, which is the ND is non-detected. And so this is just verifying and confirming that, yep, there are no toxic residues left in the product that you're purchasing. Sorry, this looks fuzzier than it did when I put it together. But last thing that some companies will also provide are, actually not really the last, but last slide on it, are microbiological substances as well. So looking to see if there's mold or yeast or any bacteria present in the product. So was the drying process not appropriate? Did it sit around too long? Was it, for whatever reason, is it contaminated with something that you don't want in there? And so this basically just says it looked for all of these substances and nothing was found, NA. And so some of them, the companies will also provide a heavy metal analysis or pesticide analysis and other things. So if there are other COAs available, great, but I would say that really the primary one is the initial COA that I explained, which tells you what's in their product. So long story short, thank you very much for listening. I know that there's, a lot of information out there. And hopefully this at least provided some of the basic building blocks as we start moving through some of the other topics as far as dosing and what products, what diseases to treat, what research is out there, et cetera. There's a lot of other topics to discuss, but hopefully this at least kind of built that solid foundation so that we can move forward with other topics, kind of all speaking that same language. So hopefully it wasn't too confusing and boring and provided some help. But I would like to just give a quick thanks to ABSC Organics for inviting me to embark on this webinar series. I'm really excited. I also give a sincere thanks, as I've done many times in the past, for funding a lot of the research that I've been able to pursue at CSU. Jessica gave a nice little kind of introduction overview of that, but just really starting at the basics. I mean, they were one of the very first companies to say, we will fund research because we want to understand if this is safe, what is and what isn't safe, what are some side effects we should be looking for, what does it do in the body? So when an animal takes CBD, is it actually getting to the bloodstream? And then from there, they've been extremely generous and forthcoming with their interest in epilepsy research and pain research, et cetera. And so really starting to delve into some of the more common ailments and diseases in animals. So thank you for that. And with that, I will end my presentation and accept questions at this point. Thank you guys for listening.
Thank you, Dr. McGrath. And thanks to anyone who submitted questions. We've selected a few to ask tonight. Keep in mind that the Applied Basic Science webinar series will probably go into depth on more of your topics and questions in the future. So, stay tuned. If your question doesn't get answered here, I'm sure it will in the future. So Dr. McGrath, does CBD have a cumulative effects? If administered regularly, will it impact a dog's behavior?
Yeah, great question. So far, we have not seen a dramatic cumulative effect. That being said, we have the maximum amount of time that we've dosed an animal for our research is 3 months. So we have not given it to them beyond that 3-month period. In the 3-month period, both from it's kind of a fancy term, but both from a pharmacokinetic standpoint. So looking at what the blood levels are. So does CBD start building up in the bloodstream or does it remain fairly steady? We've actually seen the latter. So it generally seems to kind of build up at the beginning and then remain fairly constant for the rest of the study period. Again, that's a 3-month period. Behaviorally, no, we have seen absolutely no concerns at all. And we are using fairly high dosages in our studies compared to what is generally marketed as an over-the-counter dose. So we're going quite high, and we have not seen any concerns behaviorally. And we do actually have for believe all the projects, studies that I've done, we've had the owners fill out a validated behavioral questionnaire before they start the study, during the study, and at the end of the study. So we have the owners evaluating what they consider any behavioral changes at home, reactions to the postman, reactions to other dogs, more lethargic, more active, etc. And we also evaluate them when they come to visit. So we do full examinations and we make notes on, what we think, if there are any changes that we see. And so far, we actually have not seen any changes. We had that statistically analyzed from our epilepsy pilot study and did not see any statistical significant changes. So far, we believe that from a blood level standpoint, as well as from a behavioral or side effect standpoint, we have not seen a cumulative effect that concerns us in the least.
Awesome. So would it be better to increase a current set of medications or add CBD to a pet's regimen before making the other increases?
Sorry, can you repeat the beginning of that again, Jessica? I was unsharing and I can't multitask apparently.
No problem. So would it be better to increase current medications before adding CBD to a pet's regimen, or should an individual attempt to add CBD before increasing other medications?
Yeah, so I hate to say it, and I think this is unfortunately going to be a common theme for me, is that we don't know yet. So I wouldn't say that that's continuing to increase a medication that may or may not be having a good effect. So maybe it's affecting the disease positively, but it's not affecting the animal positively, meaning it's causing adverse effects. I don't think in those situations it makes sense to continue to increase medications. In those situations, I might consider adding CBD very early on. In other situations where we don't have enough research to support using CBD alone. So for example, we know that CBD can have anti-cancer effects. Personally, I can't as a doctor recommend starting CBD instead of conventional anti-cancer techniques such as chemotherapy that's proven, scientifically research proven to have a positive effect on that disease. So I would say in those situations, I would encourage owners to pursue more conventional therapy, but maybe add CBD on as a adjunctive therapy. So use it as, this may have beneficial effects, but it's not proven yet. And so I'm not gonna risk putting my dog on CBD alone and not treating him for, diabetes or cancer or one of these other life-threatening diseases. That being said, I think the flip side of the coin is that maybe you're just feeling like your dog is getting older and he's not as active anymore, and there's nothing that you can pinpoint that is so-called life-threatening, but maybe it's just something that you're feeling like, I don't know, I just feel like I just want to give him a little bit more pep. Maybe trying something like CBD rather than putting him on a more conventional medication might be appropriate in those situations. So I don't know if that helps. So basically, I think it's very dependent on the disease. I think it's dependent on what you're treating your pet for, what the medications are that you might want to consider instead, et cetera. And so there's so many players in that question that I think it's a tough question to answer, but hopefully that kind of lays the groundwork a little bit.
All right, thank you. So another question we have is, are dosages the same for all brands, or is there a difference in strengths and concentrations in a product?
Great question. Definitely not. So no, they're not all the same by any means. And it's incredibly confusing. I hate to say it. My team, so my clinical trials team, which Brianna Thomas is one of the main players in that team, but we have a few other folks that run our clinical trials service, and they field calls and emails from pet owners all the time, addressing just that issue. So an owner looks online, buys a product, and we may say, oh, for this study, we use 2 milligrams per kilogram. That means nothing to a pet owner. It is so confusing. I mean, even for us, sometimes products they're not clear with their labeling. And so even we sometimes don't know how much CBD is in it. We don't know how many mils are in the bottle. We don't know how many ounces are in the bottle. We don't know. I mean, there's so many confusing things that are showing up on labels these days that, again, I probably should have included this at the end of my presentation, but really trying to assess, okay, I'm buying this product. I know exactly how much CBD is in it. I know how many mils or ounces are in this bottle. So therefore, I can then make an educated decision about what dose to give my dog. So no, concentrations vary, dosages vary, et cetera. And so doing that math and trying to get to um, a, a volume of liquid, if you're using an oil that you want to give to your dog, can be incredibly challenging. There are some resources online. There are some calculators on some websites that, and maybe even ABSCs, I apologize, I'm not sure, but they that help you kind of work through some of that math. But first you have to know what's actually in the bottle that you're buying. My team is more than happy to help people work through that. So if anyone ever has questions, reaching out to us at CSU is a totally viable option. But yeah, it's really all over the place, and assessing that can be a challenge, unfortunately, right now.
So I think we have time for one more question, and then we'll let everyone go. But the last question I have is, do we have any data on how CBD reacts with other medications, seizure, behavioral, or metabolic medications?
Great question. Actually, that's one of my primary interests right now is I think there's two really big things that we don't know yet. Since I've done my pharmacokinetic studies, there have been other studies that have looked at the pharmacokinetics. So we have a much better understanding of what it's doing in the body and what its safety profile is. So I think, although I wouldn't say we've exhausted that at this point, but I think at least we have a much more concrete understanding. So to me, the two main questions are side effects. So if we're using this as an adjunctive therapeutic, so we're adding it to dogs that are often times, if not most of the time, on other medications, we need a better understanding of that drug interaction that we have the potential of causing. And so I think that's very under researched right now. The other main thing that I'm really interested in is what can we do for different diseases? So does it work for all of the diseases that we talk about? And if so, does it work at certain dosages, at certain blood levels, and kind of delving more into that side of the science? So to address the drug interaction, the short answer is no, we do not know. And to me, that's kind of a scary aspect of things. What we do know is that there's been several arthritis studies and several one epilepsy study that on the vet side that did not show significant interactions with the other drugs that are commonly used to treat those diseases. So for epilepsy, for example, we accepted dogs into that study that were on the 4 most common conventional therapeutics out there, and we added CBD to that regimen. We did not see side effects associated with a drug interaction, nor did we see any changes in blood levels of any of the other drugs the dogs are on. So it did not seem to significantly affect other anti-epileptic drugs. And that is also actually seen on the human side as well. So there have been, I think, 2 now studies that have shown that it does not seem to significantly interact with other anticonvulsant medications, with a couple exceptions. But for the most part, it seems to be a relatively safe addition. Same for NSAIDs. So we use oftentimes in animals things like Rimadyl and other MSAIDs, Medicam, et cetera, that are often used to treat arthritis and chronic pain. We have not seen an interaction with those drugs either. So the arthritis studies that are out there published, plus the one that we did that's not yet published, did not seem to interact with dogs on nonsteroidal anti-inflammatory drugs. But a true drug-drug interaction studies have yet to be performed.
Awesome. Well, thank you so much, Dr. McGrath, for joining us tonight. And thank you for everyone who attended. Stay tuned for future communications on the next one. And we look forward to learning more.
Thank you, Jessica, and thanks, ABSC.